When a patient presents to the office with suspected latex allergy, the first thing we do is take a very detailed history. We're looking at the symptoms they express, the jobs that they're involved in, such as a healthcare worker, a patient who's had spina bifida, multiple surgeries, and things of this sort, which are clearly greater risk of developing latex allergy. The next thing we look for is increase in symptoms. We're looking what they're exposed to, when they start having symptoms, and what type of symptoms do they have, such as putting on gloves and developing a rash in their hands, which has now progressed. Are they having trouble with foods, such as eating bananas or chestnuts or hazelnuts? Has there been a new development of allergies as their symptoms have progressed, so that other allergies are now being expressed? Once we've done this, we will do appropriate tests to see if we can confirm this, although this is definitely not 100%, but is a reasonable thing to try. And then we will help patients with avoidance, various coping skills, because at this point there is no cure. The treatment is avoidance. Medical alert tag, because exposures, especially in a medical facility or an emergency, can be very life-threatening. Once these patients are armed with this, then we follow them along and try to support them with this chronic problem.
Basically anything that contains rubber will cause me to have a symptom, and a lot of the fruits, when I eat them, they cause me to have symptoms.
Every morning during all of the operating room cases, people would put on latex gloves and prep a patient and then take their gloves off and snap them off at their wrists, and all the powder would fly in the air, and that carries the latex protein.
First full-time position as an RN in a hospital that had used powdered latex gloves was where my symptoms progressed to much more itching, further rash, and some tingling around my mouth, and some wheezing and shortness of breath as the months went on.
As we stated earlier, we come in contact with allergy-causing latex proteins by direct contact with the product on skin, eyes, mouth, and in any opening of the body, breathing in the powder found on some latex gloves and other products, injecting fluids into the body through latex medical equipment, and by ingesting the proteins when food is prepared while wearing latex gloves.
When I get an allergic reaction, the first thing that happens to me that I can tell that I'm having an allergic reaction is that my lips will swell up. And then from there on, I get, sometimes I'll get like hives on my hands. My throat begins to itch, and then it like closes. My chest, when I breathe in, I get really bad pains, and it's hard for me to catch my breath just by walking.
Over time, my symptoms progressed from runny nose, itchy eyes, sore throat, rash on my hands, to not being able to breathe.
My hands would get very red and irritated, and then I found that I would not only get red and irritated, but I started getting hives and even blisters from wearing the gloves.
Towards the end of each shift, I would notice I was breaking out in hives and itching and burning, and that would pretty much clear up when I left the hospital the following day.
Identifying products that contain natural rubber latex and making an appropriate substitution can save a life. Natural rubber latex products are not always easy to identify, especially if they are not labeled. A common misunderstanding involves latex paint. For the most part, latex paint contains no natural rubber latex. It is a man-made product. This can be confusing because some synthetic products referred to as latex do not contain the proteins that cause allergic reactions. In 1997, the Food and Drug Administration issued a regulation that requires labeling of all latex-containing medical devices that contact humans. However, the labeling law does not yet include everyday consumer products.
Latex allergy prevention is based on latex avoidance and finding alternative solutions. Latex responsibility begins with you. Learn to protect yourself and learn to protect others. Here are 5 key prevention measures.
The first measure is
minimize latex exposure.
The school has changed by banning all latex gloves from like the entire school, from the science classes and the nurse's office. And they banned all latex balloons, and now there's only Mylar allowed.
As far as future employment, I'm looking forward to working in facilities that are latex responsible and aware of the problem.
The early diagnosis is important because you limit further exposure to the allergen.
The second key prevention issue is
learn to recognize symptoms.
She was blowing up a Halloween decoration, much like a balloon, and her lips swelled up. They were itchy, they were red.
The best advice that I could give to other healthcare workers who develop these symptoms is to not ignore them and to acknowledge that they're real and that they are related to the latex that they're exposed to every day.
another key prevention point.
Know the high-risk groups.
Through educating our staff, we have made them more aware of what risk groups to look for when they're admitting our patients. They pay specific attention to patients with spina bifida, patients who have had multiple surgeries, have multiple allergies, or if they work in a field that may expose them to latex in some way. We also know that some patients don't even really know that they're having the reactions to the latex allergies. So we ask them if they've ever had any problems when they've gone to a dentist or if they've had problems around balloons at a birthday party.
Another important issue of prevention is
Wear a medic alert bracelet and carry emergency supplies.
You have to be careful everywhere you go. You have to make sure you have emergency equipment available and your emergency medications available if you need them, and you do not always know when you're going to need them. You're exposed to latex. I found in many different situations, in many different environments, and I carry emergency equipment with me at all times now.
And the last prevention point to remember.
Be your own advocate.
Yeah, I do have spina bifida and latex allergy, and I do teach others about it. Nursing staff, people in wheelchairs that may not know about it, anybody really. To keep myself safe, I call restaurants, my medical supply company, any place I go that may use, that I think would use the latex, I call to see if they do use it and what are the alternatives.
Our office has been made latex-free in order to facilitate patients with this disorder coming and feeling secure and not being exposed. Further, we're trying to work with the various hospitals in our community to help them develop a latex-free environment so that they don't become ill in the process of going to an emergency room or visiting a friend in the hospital.
Latex-responsible healthcare facilities, workplaces, schools, homes, and businesses will reduce new cases of latex allergy and provide a better quality of life for those who already suffer from this condition. You can break the cycle of latex allergy. Become aware. Take action. Latex responsibility equals prevention.